Hello, everybody.
Hello.
I see we have another. Is it Catherine and Claudine? Welcome.
Thank
Hi,
you.
yes.
Hello.
Okay, well, I guess we'll go ahead and get started. Is that okay, Michael? And if
That
others
sounds
come in,
wonderful.
you'll just kind of let them in and then just mute them as they come in. That would be great. Well, welcome to our Emory open house and welcome to the ENP open house, as they say, right? Um, I do want to start out by just introducing myself. And then I would like to also just kind of get a feel of who I have on the call today, and just tell me a little bit about your background and what sparks your interest into the program. So I'm going to first start by closing out of my email so you don't hear all those alerts coming in. At least I thought I did. Give me a moment. Give me a moment here. There we go. Okay. So a little bit about myself. I'm Dr. Paula Tucker. I am the interim program director for the Emergency Nurse Practitioner program. And I also have the pleasure of being able to graduate from such what I call an amazing program. So, being able to share about the EMP program, I do bring an experience. And so I can provide that perspective as well as a student and also as faculty who have taught in this program for quite some time. And I can truly say that my experience has just really been great. And I wouldn't trade it for the world. So I consider our program as one of the top programs in comparison to other EMP programs. Um, so I am a board certified family as well as emergency nurse practitioner. I currently practice, if you all are familiar with Grady Memorial Hospital, which is our level 1 trauma center in Atlanta, Georgia. I practice as an emergency nurse practitioner, and I'll go into some details later about our clinical sites, and that is one of our amazing clinical sites. Students have an opportunity to engage with the providers there and learn a lot of their trauma competencies just by being in the trauma center. So that's an exciting and highlight of our program. Um, Prior to joining the Emory faculty, I completed my DNP as well. Unfortunately, I did it at Vanderbilt. At the time, they didn't have an Emory program. And when I completed that DNP program, I also did some additional training as a VA Quality Scholars fellow. And that's where I had the opportunity of learning quality improvement, methodology, and implementation science skills that would be of value to the research team. And so I have the privilege of being able to not only be a clinician, but also translating the research to the bedside. So I'm actively involved in several research projects within the emergency department. And I have the privilege of working with some great emergency physician researchers. And then also, I'm getting my PhD as well, and I'm hoping to graduate in 2024. So, pretty busy life. And I say all that to say, because I think it's important that you understand that when you enter into this role of academia and this lifelong learning process, that life still moves on, right? So I still have 3 kids that are growing, and I practice clinically. I work full time, and I'm also a student. So I bring an experience to you that you can do it if you choose to apply to this program and be a student. And I'm sure you all bring a level of life experiences as well, so it can be done. So that's about me. I know it's only 2 of us on the call, but if Claudine, if you could kind of share us a little bit about your background and what interests you in the emergency program. I think you're muted. Okay, no worries. All right, and then what about Catherine?
Hi, yes, can
Hi,
you hear me?
Catherine. Yes.
Hi. So I'm in the Master's of Nursing program right now at Emory. I'm in my second semester. And then I'm hoping to take that year off to gain clinical experience, hopefully at Grady, and then go straight to the DNP in emergency nurse practitioner. I currently work at Children's and I work at a urgent care outside the city, but we see very high acuity. Everyone treats it like an emergency room. So that was kind of my first experience with trauma and emergency medicine. Got a couple patients we had to like call the helicopter and treat them as a trauma and send them out to the hospital. So that was very exciting, and I'll never ever forget those patients. I did my undergrad at Florida State. I was pre-med there, and I also worked in urgent care there, a little bit less higher acuity, but also got some of the feel for the outpatient setting. Yeah, I love everything about trauma and emergency medicine, and I'd love to work in the ED as a nurse practitioner.
Awesome. Well, you're on the right track, and it's exciting to hear that you bring that background. And I think that's really important to our program. I'm not sure if you've had an opportunity to look at some of our requirements, but we do want our applicants to have at least 1 year of RN experience, working experience in the emergency department. We'll even accept military trained professionals as well. So that is exciting. Okay, then. Well, what I'm going to do, because I do have a brief PowerPoint that I want to run through that I think will be helpful to provide some more details around our program. So I'm going to share my screen here. And then let me see. I always struggle with with. Oh, hold on just a second. I'm not the most technologically sound individual, but I'm working through some things. So let me stop sharing because I need to. Um, okay. Okay. We're getting there. Now let me.
You should be able to hit the backspace button and it'll start reversing slides.
Okay, there we go. Can you see this? What do you all see? You see that
So
now?
we do.
Okay, I'm trying to. Is that better?
That's good.
Can you see that? Okay, now I got to get all this stuff off my screen because it's impacting my view. Okay. All right. So you can see my PowerPoint, and I've told you a little bit about myself. Like I said, I'm the interim program director of the EMP program. I'm a graduate of the Emory EMP program, and I actually started working at the School of Nursing in 2015. So I also want to share with you that this understanding of emergency care and the role of the emergency nurse practitioner, because I think it's important that I provide some insight into that. So emergency care, and I'll often use that term because it's very broad. Emergency care is not necessarily defined within an emergency department. So just as Catherine was stating, that she works in an urgent care setting, that is emergency care, because oftentimes we are providing emergency care outside of the four walls of the emergency department. So emergency care really is about a practice that is delivered in diverse settings, but it's not limited to the emergency department. It can be the urgent care clinics. It can be in our clinical decision observation units. We can provide emergency care and emergency medical response vehicles, telehealth, even disaster locations, and these new innovative models we have now, which are mobile urgent care like dispatch health, occupational health centers, and even correctional facilities. So what I love about emergency care is that it is a unique specialty practice that encompasses evaluation, management, and treatment of patients who experience an unexpected illness or injury, whether that it can be in various complexities. In fact, 68% of patients that we see really are across the lifespan. And when I say across the lifespan, I mean patients that are from the cradle all the way to the grave. And these patients present to the emergency department with these primary care problems. I also want to highlight that when you think about the emergency nurse practitioner role, that role is developed on the foundation or academic preparation as a family nurse practitioner. So as we move into this presentation, you'll understand that a lot of your coursework will align with the family nurse practitioner, okay? And so the specialty training is the emergency, okay? That is the training on top of that you'll get. And the reason why you need the family nurse practitioner is because it prepares you to care for patients across all ages. And then you'll receive the additional training in management of patients with life-threatening and urgent conditions. And this is the most appropriate preparation for practice within emergency care settings. So you may even ask, okay, so what about the acute care nurse practitioner and the association in emergency care? Because we do have some acute cares that are working in emergency care settings. However, these nurse practitioners have a very limited scope of practice based on patient age. So acute care nurse practitioners are not necessarily prepared to work across most emergency care settings, given the lack of education and training and the age cutoff on the patients that that their scope will allow them to see. In the same, F&Ps are not prepared to work across emergency care settings because they don't have the training necessarily in acute resuscitation and stabilization of patients with life-threatening conditions. So I felt like it was important to kind of share that with you. Okay, so I think here, this is a picture of myself. I look quite different. My hair is changing, but here is also Dr. Alan McCullen, who teaches alongside with me in the program. And he's just a delight. And he's been teaching with us for quite some time, I think since 2000, maybe 16. And he's also an Emory ENP alum as well. So what are ENPs prepared to do? Essentially, ENPs or emergency nurse practitioners are prepared to provide care to patients, as I mentioned, across all ages, ranging from acute resuscitation and stabilization of life-threatening health conditions to management of even minor injuries and illnesses. And the role of the ENP mainly consists of medical screening, specific emergent and urgent care procedures such as 12-lead EKG interpretation and radiology interpretation, providing wound management, foreign body removals, basic ortho procedures such as splinting and reductions and even arthrocentesis, and then even all the way to resuscitative procedures, which include chest tube insertions, central vascular access, and airway management. So these are mainly our competencies that we will teach within this program. I do want to highlight some facts. As you can see here, we have approximately 325,000 NPs who are practicing in the United States. And this was data that we collected from the American Association of Nurse Practitioners in 2021. Interestingly, 69% of those NPs are family nurse practitioners. Now, when we pare this down to the emergency department, about 21,000 are working. I think this is an underestimation of the data because we just don't have a lot of data sets to pull from. But approximately 20,000 are working in the emergency department. And of those, 96% of those NPs working in emergency departments are family nurse practitioners. 90% work with patients of all acuities. And as of right now, we have about 14 graduate EMP programs, but there are more that are in development. And we have about 15 EMP fellowship programs. And this data comes from the American Academy of Emergency Nurse Practitioners. In 2014, AAEMP established with 10 members, and now we have over 1,000 members. We recently launched back in 2017 the EMP board exam, and as of right now, we have close to about 1,200 board certified emergency nurse practitioners. So what does that mean to you? So when students finish the program, they will be eligible to sit for the emergency nurse practitioner certification, as well as the family nurse practitioner certification. And in order to sit for the emergency nurse practitioner certification, you have to have completed the family nurse practitioner certification. So there's some layers to this, and that's why it was so important that I start this presentation off with providing understanding to the family nurse practitioner requirement and education, and then building upon that with the emergency specialty. Here are some more demographics that I want to share with you that I believe is important as we talk about this role. 54% of patients are females, and of those ranges are between 15 to 64. And when we talk about the acute care specialty, they don't have the training necessarily to manage a lot of the female issues that we often present to the emergency department. So this is where we have those the role differences. A lot of those involve pregnancy, childbirth as well. 22% of the patient population are going to be pediatrics, and then 53% of those are going to range between 0 to 4, and 28% will range between 0 to 1. So we do see a fairly amount of pediatric patients. Now, it depends on where you're working, particularly here in Atlanta, we have, a children's hospital. So, a lot of those patients will present there. But then in some cases, if you're working in rural areas or not in academic settings, you may not be privileged to have a children's hospital. So this is why it's important that, when we hire in the emergency department, we're hiring those NPs who have that scope to see not only adults, but also children across the lifespan, and then able to manage female issues that are related to complications of pregnancy, as well as childbirth and even peripurum. And then we move into about 83 to 90% of all patients seen in the emergency department are treated and released. So a lot of what we provide is primary care. And then about close to 20% are admitted nationwide. And then 31% are triaged as a level 3. So a lot of what we do in this role is really manageable, and we do bring value to this, to the emergency department as well. So I do want to just show this picture here. This is the consensus model, and I think this really helps to break down and provide a little bit more support to what I was stating earlier about the role. So as you can see at the bottom of this pyramid, that is the role. Your role when you decide to become a nurse practitioner, your role is the nurse practitioner, but then you have a specific foci. What is your target population? And that is family. And that's where you get your family nurse practitioner. So you have roles, which is the nurse practitioner, but you have a population that you are learning about, that you are trained to care for, and that is the family. The family nurse practitioner, okay, because you're able to see patients across the lifespan. And then in addition to that, we have what we call specialties, the APRN specialties, and the emergency nurse practitioner is a specialty. We are the consensus model has given AAENP authority to provide oversight to the specialty training. And this is where the ENP has been developed. And so when you, if you come into this program, your education will align with both the family as well as the emergency as specialty training. All right, so I want to talk a little about the evolution of our program and how we initially started. So, I will state that we've been in existence since around 2002, December 2002, actually. And this program was actually funded by the Bureau of Health Professions, Health Resources and Services Administration. And it was through this funding that the EMP program successfully joined with the Emory School of Medicine Department of Emergency Medicine to create what we call an amazing interdisciplinary academic partnership to specifically train emergency nurse practitioner students with emergency physicians. And I'm going to tell you, this has really been this is really the game changer to this program because of the relationship based on this funding. Even today, we have physicians who come and lecture to our students. Our students are also have the opportunity to work alongside a lot of these physicians in the emergency departments at Emory as well as Grady. And that is really the highlight to our program. Really this interdisciplinary education and training. And since the establishment, I think we've graduated close to about 200 and maybe 50 students from the program. And currently these students are working within emergency care settings across the country. So this is really, this program has been a success because of this collaboration. And our role is to continue to sustain this relationship as long as we can with the Department of Emergency Medicine. I also want to highlight a key component of our EMP program that I believe sets us apart from other EMP programs across the country because of the partnership we have with the Emory School of Medicine, Department of Emergency Medicine. Our curriculum and training is based on an interdisciplinary model where our students train with the residents that help build competence in team-based care. Remember, the emergency care that we provide, particularly in the emergency department, is a team-based approach to care. And we believe this clinical training model is crucial to the role and significance of the emergency nurse practitioner. All right, so let's talk about the evolving role of the emergency nurse practitioner. I would like to now highlight some specific emergency care settings in which an EMP is prepared to practice. EMPs provide rapid evaluation and initiation of care in emergency department settings, also in pre-hospital settings. And so here is our previous EMP director, Dr. Diane Evans, who's precepting one of our EMP alums at Emory University Hospital in the triage department. And this alum, Ariel Estevez, now owns her own urgent care practice up in North Georgia. Okay, EMPs are also prepared to work in the emergency department fast track zones and urgent care clinics. And here are two of our Emory EMP alums that are working in an urgent care now in Portland, Oregon. Now, this is a really cool, innovative model that we're seeing now. It's called Mobile Integrated Healthcare Teams. And this represents an emerging innovative care model where emergency nurse practitioners provide urgent care in a patient's home that is supported by a paramedic. And these teams provide care for lower acuity problems, including repairing wounds, administering IV fluids, and even managing medications to ultimately reduce unnecessary emergency department visits. So this model of care is really increasing due to its cost effectiveness and even patient satisfaction. Patients don't want to come to the emergency department if they don't have to. So I think that this is a really great opportunity to really highlight the role of the EMP in an emergency care settings. All EMP students will have the opportunity to complete clinical hour training in mobile integrated healthcare teams. So that's an exciting partnership we have. Another emerging care model is the utilization of telehealth to facilitate emergency care across diverse settings, such as within emergency departments, as well as within clinical decision units or observation units. And this is an opportunity to deliver emergency care even in rural and critical access settings. Now, one of the first clinical rotations our students will complete is working in the emergency department observation unit. Now, this is an opportunity for our students to really understand how we are providing care to emergency department patients who are admitted for time-limited workups. And this is a protocol-driven approach. Not only that, but it has been shown to be cost-effective in reducing hospital admissions and even emergency department readmission. So overall, with this protocol-driven approach, we're seeing improvement in patient outcomes as well. So now, while EMPs may work autonomously, providing care to patients who present with lower acuity problems, EMPs are also prepared to manage patients who require higher levels of care. And I really want to emphasize that working in higher acuity and trauma areas within the emergency department is not an autonomous role. You will not do this alone, but rather it is a team-based care that is led by the emergency department physician. Another highlight to our EMP program is the opportunity to obtain about 200 clinical hours at Grady Memorial Hospital's Level 1 Trauma Center. And you're going to have the opportunity to work alongside our residents as well as other APPs. And when I use that word APPs, I mean advanced practice providers, and this includes nurse practitioners and physician assistants. And we also have the opportunity to learn about disaster preparedness and response within the program. Our EMPs are required to be on the front lines when a disaster occurs. And so a required disaster preparedness and response course has been integrated within our program for students as a competency for such the role. And as you can see here, we have all these pictures I'm showing our alums and when they graduated and some of the opportunities that we have. Like, for example, here we had the opportunity to participate in a multi-agency disaster drill at Dobbins Air Force Base back in 2016. Now, as healthcare is shifting and patient populations are aging, what we're finding is that access to emergency care is often limited in rural communities. And so we prepare our EMPs to care for older adults and to work in rural emergency departments where workforce gaps currently exist, and even the knowledge of how to use telehealth and work within mobile integrated healthcare teams is really important. Now I want to talk a little bit about the program itself. So in addition to the prerequisites we talked about for admission into the Emory's EMP program, our curriculum focuses on preparing EMPs as clinical experts and leaders through a 7-semester integrated doctorate of nursing practice degree. So you might ask, why is a DNP necessary? And as healthcare is constantly changing, and emergency care is evolving, the role and practice of the emergency nurse practitioner is critical in leading and translating what we call safe, evidence-based, high-quality care within the microsystem of emergency care. And we believe the Doctor of Nursing Practice education provides these skills within this ever-changing, complex healthcare system. So when our students finish this program, they are now viewed as the clinical expert, okay? So in addition to the required DNP project and program hours, the DNP EMP student will be required to complete a total of close to 1,200 clinical hours. 500 of those hours will be dedicated to primary care, and these settings will include family and emergency care settings. And then 640 of those hours will be directed to the emergency department. And so students will have the opportunity to have their clinical rotations at Grady, in the Emergency Care Center, Emory Healthcare, Piedmont, CHOA, and even within our mobile integrated health. Our clinical rotations, as I mentioned, will be pretty expansive, and students will have what I believe to be some valuable clinical rotations as well. This program is extremely rigorous. We do have a part-time option through the NEL Fellow Program, and if you have more questions about that, I will be happy to get that information to you. But it is a rigorous program, but we value the education and training, and our goal is to provide excellent education to our students. I do now want to highlight some of our procedural skills trainings that we provide within the EMP program. As you know that we provide airway management, so airway is a big component to that. Procedural skills training as well. We also train our students to perform lumbar puncture, and these are just a few. We have a whole list of training skills that we provide within the program that align with our EMP competencies that we have to meet in order for our students to be prepared to sit for certification. We also provide skills trainings and precipitous delivery as well. And then there are some other great opportunities that our students have to participate in service learning activities that comes out of our global health department. And here are a group of our students who I think they were at Moultrie, and they had an opportunity to provide care to the farm workers as well. We do a lot of great simulation activities. We have some exciting educational adjuncts that we provide our students, all the way from mock code simulations to even ultrasound training, ECG interpretation. So we try to provide opportunities to promote learning and facilitate that learning in certain simulated spaces. And then we even have in-class simulations as well. So that's a really good opportunity. If you want to know more about the EMP role, I recommend that you take a look at some of these professional organizations like the American Academy of Emergency Nurse Practitioners, the American Association of Nurse Practitioners, and Emergency Nurse Associations as well to learn more about it. But this completes the overview of the EMP program. I want to thank you for your interest in the program. Please don't hesitate to reach out if you have any further questions. And I hope that this was informative. And at this time, I'm going to end the presentation and open it up to any questions that you may have.
I have a question regarding my personal next steps, but I can email you if that's easier to do.
You can, or you can pose them here. It's whatever you feel comfortable with.
Sure, I can ask. I'm just wondering as far as for myself. So I'm in my second semester getting my master's. I'll graduate with my master's next August, and then I'm eligible to take the NCLEX. And I was under the impression, or I was told previously when I explored interest in this program, that I can work for a year as an RN in the emergency department, and then pending acceptance, go straight into the DNP. Is that true?
Yeah,
How would I go about making sure?
So, I think that I would defer that back to admissions on what that looks like. But, it sounds like that pathway that you're explaining seems appropriate. You would complete your MN, right? Your MN, and then you would take your NCLEX. And once you've done that, you would find a job in the emergency department, right? And you would work for 1 year. And after you've met that 1 year requirement, you would then apply to the DNP EMP program. Does that make sense?
Yes. So could I apply while I'm currently in my 1 year of working? I guess is my question.
No.
Okay.
Mm-mm.
Okay.
Yeah. And I get that question a lot, but what we're trying to do is make sure that our applicants have a good understanding about the emergency department, and that they understand the setting and role. It's not for everyone. It is a pretty intense department. And some RNs, I think within these healthcare systems, they have residency programs, right? So that they train you on how to actually work in the emergency department. I think it's like kind of on the job training as a RN. And, in reality, it's just not for everyone. And I think this is an opportunity for us to be able to make sure that we're getting applicants who are dedicated to this setting and the care that we're providing. So that's why we want to have that 1 year. There is an opportunity as well that I want to kind of put out there to you. We have a NELS fellow program. It is an extended part-time program. And Michael, stop me if I'm over speaking. This is not my space necessarily, but I know they have a pretty extended part-time option to the DNP ENP program through a pipeline called the NELS fellow. And what they do is they some of them are already working in the emergency department, and but by the time they hit into their clinical sequence, a lot of them have already hit their 1 year. So it is an opportunity for them to still work and get that experience and still make that money. And then but I think they have to like work for Emory Healthcare when they're done with the program.
Okay.
Great
Thank
question.
you for that link.
Yeah,
Thank you.
absolutely. Any other questions? And Claudine, if you're not able to chat, you can, talk, you can put it in the chat if you have any questions as well.
No, I was driving, so I didn't want to like lose focus in that. But no, I have no questions at all. I was listening though, but thank you.
Great. Awesome. Well, if something comes up, you can always email the admissions office or reach out to me individually. I'm happy to answer any questions that you may have.
Okay, that sounds good. Thank you.
Who is the contact for the admissions office for you guys?
Michael just put it in the chat for us.
Oh,
He's
perfect. Thank you so
director of
much.
admissions. Yes. Well, if you all don't have any questions, I just want to say thank you for your time and the interest you have in the program. And we can go ahead and stop the recording and end our session.